to put a triangular flap right at the crease there.
We expose a muscle layer over the top of the metal.
Because we need a 2 and a 3 centimeter wide.
Tilt toward your left. Relax a little.
It's really about the mission. Fixing a limb that the child will use without problems for the rest of their life. Correcting a spine problem, which literally can save their life, whether it's opening up their chest to allow their lungs to develop, or correcting a severe spine deformity, taking out a tumor. It's really about having a positive impact on a young child, which is going to last a lifetime.
Thanks.
For a CHOP orthopedic surgeon, the days start very early. Many of my colleagues are here by 6 o'clock in the morning preparing for surgery.
All right, Matt, how you doing? So we're going to unlock both devices today.
For us, it's been quite an experience, but you know, this place is the best. It's amazing because we just happen to be 10 miles away from CHOP.
Many families travel around the world to get here, so we're very thankful that we don't have to travel.
Every time we sit in that waiting room and hear all the different languages being spoken.
Matthew Howder, neuromuscular syndromic scoliosis. Plan is bilateral partial thoracotomies with expansion of the vectors and correction of truncal shift. Any questions, anybody?
Matt's had about 27 surgical procedures in his life.
He couldn't walk, he could barely sit up, he couldn't breathe. It's been transformative for Matthew.
Well, I feel more confident. I had like low self-esteem, and then after the surgery, I just felt so much better, and I just looked better. I had to get used to the way the rods were in my back. I went into it thinking I wasn't going to be able to do anything. Now that I know that I can, I'm really happy about it.
With his disease, there's muscle tightness. We met with Dr. Baldwin for the tendon release surgery to kind of lengthen them and let them stretch out. And now his body's not actually fighting itself to walk.
It's that long-term goal of one day he will walk, whether it's with assistance or not, he'll walk.
He'll be upright, yeah.
He will do it.
Hi guys, you ready for a little tune up today? So go ahead and point to that bum knee for me. I make an extra incision because I use your hamstrings as your new ACL. Okay, so this is Benjamin, R-U-T-H. He has a right ACL rupture. We're doing a surgical arthroscopy of the right knee, ACL reconstruction using his own tissues. We're going to take down a little bit of that base of the ruptured anterior cruciate ligament. We took 2 ligaments and tendons and quadrupled them for an 8-strand graft, which is stronger than the native ACL.
What happens is club feet are very unlike other feet because there's lots of other tissues that are scarred up behind the ankle. So you never get like overcorrection by doing it.
Right.
You know, do it in somebody who doesn't have it, I'm sure you could really cause problems.
Okay.
Hi, how are you guys doing?
Great.
How's everything going?
Good.
How's your boy doing? How you doing?
My God.
He had a big operation not too long ago. How's he responded to all this?
Really good, you know, no pain, nothing. And look, there's a project. It's great.
Is he taller than he was before?
Yes, he has to lower his head to get into the van.
That's terrific.
Yeah, go into the back.
Awesome. You're doing great. You're an all-star.
Yeah.
You're an all-star. I'm so proud of you. They moved down to Florida, and his scoliosis progressed 85 degrees in the course of about a year or so, and they moved back up here because they were concerned that they couldn't get the same kind of care that they were getting when they lived up here.
Josh was close to losing his lung, but today we can say a success story. You know, Josh is totally straight.
This is the reconstruction after the tumor surgery. This replaces the bone that was destroyed by the cancer. We have no cancer at all, and we're gonna watch her carefully, either here or in Saudi Arabia for a long time.
Thank you so much, doctor. Thank you because you saved us, because back home they told us they have to remove the whole upper limb. But here, you suggested different surgery, and it worked.
I was diagnosed with hip dysplasia, so it pretty much meant that my hip bone was out of alignment. By the time I finished my freshman year, I couldn't really run anymore. I was having trouble sleeping and standing because I was in pain so much of the time. I was told, like, you're gonna have to wait until you have a hip replacement at 35, and then you're gonna have another hip replacement, and then another one, and maybe another one. So Dr. Sankar cut my bone and then repositioned it and pinned it so my bones could regrow around the pins and then be removed. Since I had my surgery, not only did I relearn how to walk, but I also relearned how to run. And in the fall, I ran my first marathon, which is 26.2 miles. CHOP changed my life.
I tore my patella tendon, and that's the kneecap tendon that holds your kneecap to the rest of your leg, and I snapped that. I think sports kind of defined me. I played basketball, I played soccer, and I'm running track this season. They really take good care of me, and I see why they're one of the top hospitals in the country.
So half of our time is actually spent trying to understand really the basic fundamental mechanisms by which the skeleton forms and grows. And then the other half of our time is spent trying to find treatment.
What I would do when you go home is write down a series of tasks that you would like to be able to perform with a prosthesis.
What she really wants to do is play the violin.
He should not play catcher right now until his shoulder is completely better.
Playing against her team, or like just playing by yourself.
Any kind of playing. I don't want you to get hit because that thing will break again, and then you'll be sorry. So we're gonna make you a new thumb today. What do you think, Logan? Yes?
Good.
Okay, this is Logan Stefanski for right hand syndactyly repair with full thickness skin graft. Yes?
Yes.
So you've got this egg-shaped ball, and it's almost like it's sloped off to the side. Really, it's kind of like that balancing the ball on the seal's nose. You want to get the socket that he has, which admittedly is not the same size as the ball, but you can't shrink the ball down. You want to balance what socket you have over the top of the ball. Do you have any questions for me, Aaron? Okay, you're a trooper. All right, see you guys tomorrow morning. Take care. Okay.
He told us that her left hip had been dislocated probably since birth.
Yeah.
It was about 6 hours of surgery. Brooke came out, and we had told her she was going to get a turtle shell because she's really into turtles, and so she had a body cast. You know, we would have traveled anywhere in the country to get her the best surgeon, and I think we wound up with that. And they told us if we hadn't done the surgery, she probably wouldn't be able to run by the time she was 15.
I like to play my piano. I like to jump. I like to run. I like to play soccer. I like to ride on my scooter.
I used to get surgeries constantly when I was a baby. I've grown up with those doctors and nurses, and I love them all. I'm so grateful. My left lung is not as large as my right one, so I had some trouble breathing when I was younger. They didn't know if I was even going to be able to talk when I was a baby, so I got sign language up until about age 6 or 7. So from going from like my parents not even knowing if I would be able to talk like at all to being at the place where I can sing in a choir is really cool. I have so many hobbies and interests now, and I guess there's no limit to what anyone can do if they set their mind to it, really.
One of the things that makes it so rewarding to work with this group of orthopedic surgeons is how much they enjoy just coming to work. I mean, you drive home at night and you just realize that you had an impact that's going to affect a human for the rest of their life. It's so rewarding that even the long days seem to go by very quickly.